The therapist said they were able to feel the disc in my back bulging. The therapist said that they were able to feel the nerve that is trapped down my leg or down my arm or in my back. The therapist said they have popped my disc back in place. So these are very common statements that I hear from a number of my patients. Given the challenges in the NHS, particularly in primary care, with access to your GP and or otherwise physiotherapists recognised in the system. Unfortunately, a lot of people are now resorting to private access, paying for their service, paying for an opinion. And these are three statements that, as I say, have been recurring. And the question is, for me, how credible are these statements? Are you going to someone who's credible? Are you going to someone who's well versed and conversant in their field of practice? And unfortunate it is, and I'm not going to sound unprofessional here, because I'm not naming any particular professions, but there are a good number of individuals, both qualified to quite high levels, as well as qualified to arguably less qualified, who are quite openly misinforming patients. If anybody came to me and said they could feel the nerve that is trapped in my back, I know I'd be walking out of that clinic. If somebody said to me that they are able to feel the disc that is protruding, the slip disc in my back, not that I have one, but I certainly again would be looking at leaving that room, fees paid or not. What would concern me in both of these situations, and even one step further, if somebody said to me they have popped my disc back in place, once again, I would be looking at leaving that place in the interest of my own safety and my own health. Because as far as I'm concerned, this is not possible. And as opinionated as this may sound, I would argue and say it is an opinion based on some reading and some formal qualifications perhaps. Keeping to the point, and I'm going to get you to think for yourselves on this matter. When a patient says to me that the therapist or the practitioner, and notice I say whatever level their graduation or qualification might be, credible or not, if somebody says to me they can feel the disc that is protruding or bulging in my back, what we call a disc herniation, I will give you the analogy and I will ask you, if I made the claim and said to you, this wall behind me here, if I said to you I can feel the brickwork and the gap between the bricks, would you believe me? And for the most part of it, most of you would raise an eyebrow. I should like to think all of you would raise an eyebrow, because you know full well the anatomy of this wall, the basic anatomy of this wall, in that we have the bricks on the outside, followed by whatever else, and we've got a layer of plaster through which I cannot feel anything. Well, let me put it clear that this is your vertebral column. This is you looking at it from the side. This area here, these circular bits here, are the bits on the frontal aspect. That bit is around the back, and these little pointy bits are what you feel when you run your finger down somebody's back. You cannot feel these what we call transverse processes let alone anything further forward from that. And notice the discs sit anterior, further forward to that. In addition to that, what we have is all this area here on either side of these. Again, run your hand down your back or your colleague's back and feel those spinous processes, those little knobbly bits as you go down the spine. Either side there's a whole load of musculature. And so because you cannot push through that musculature, it's very difficult to feel the transverse processes. Now the disc is sitting further forward to that. One would argue and say, yes, but the discs protrude backwards. And I completely agree. And let's be more accurate. Most discs will protrude in what we call a posterolateral direction, i.e. they go backwards, but more to one side, so kind of 45-degree angle that way or 45-degree angle that way. A few of them will be broad-based central, i.e. going backwards directly. But they do not go past that transverse process for the most part of it. They remain inside the spinal canal through which the spinal nerve runs. And so somebody saying they can feel the disc that is pushing, bulging outwards or protruding posteriorly is equivalent to me saying to you and satisfying you and you believing that I can feel the brickwork between that wall. The latter, you know, is completely untrue. So accept that anybody saying to you they can feel the disc protruding in the back has a serious, for me, I have serious concern, and I would question the credibility of their basic human anatomy, not even advanced, it's a basic human anatomy. In a similar fashion, somebody says to me that they can feel the nerve that is trapped in my back or down my leg. I will then give you the analogy and say to you, you've got your light switch on the wall, you know full well there's a wire or wires going up to the light bulb. I say to you, I can feel that wire through the plaster, which the wire is embedded in the wall. I can feel that. Again, I should like to think each and every single one of you will question the credibility of my statement. Nerves are for the most part not palpable from superficial anatomy. The biggest, longest, thickest nerve in the body is the sciatic nerve, which is approximately the size of the thumb, like so. Two branches together until it then separates. That is not palpable in the absence of extreme cases. My patients who walk into my clinic, any patient that is walking, that nerve is not palpable. So if anybody says to you they can feel that nerve, is again, for me, massive question mark over the credibility of that statement and over the credibility of their qualifications. They have a serious lack of understanding of basic, and again I stress basic human anatomy here. This is not advanced medicine, this is not advanced anatomy. Last of them, the statement I made was the individual part of my disc back in place. Discs are extremely resilient rubber structures made up of two layers: the nucleus pulposus, which is a liquid gelatinous substance on the inside of the cell, surrounded by the nucleus fibrosus, 25 layers, crisscrossed of fibrous material, extremely tough, extremely resilient. You imagine living 70, 80, 90, 100 years and you'll get some wear and tear on that, but generally it won't actually give you much issue. Now, can I get the force and the vectors so accurate that I can push that disc back in place? Question mark, question mark. And I appreciate there are techniques that have been claimed to be able to reverse some of this, exercised by, again, recognised professions, the credibility of which anybody hasn't really researched. Nobody has actually criticised or reviewed the actual effectiveness of these techniques and programs. 3 or 4 years it takes for a disc to scar and heal. On the back of the fibrotic scarring, it then shrinks, and if there is nerve entrapment associated with that disc injury, that then is a little bit easier, but 3 or 4 years. some of them saying they can pop the disc back in place is extremely, extremely infantile or premature in their understanding. Yet again, another situation where I would say, question mark, I'll see you later, and I would question. So I hope that gives you an indication. 3 most common statements that patients have made over a number of years, more so latterly, due to the pressures, and I understand. But if you are going to go and seek an opinion, please seek somebody who is credible, somebody who has a deep and a good, deep understanding, and someone who perhaps has come recommended. Thank you for watching.